All right. Hello, everyone. Welcome back to Being the Best Version of Yourself. I'm your host, Dr. Carey Heller. Today, we have a special guest, Dr. Dara Abraham. So why don't you go ahead and introduce yourself?
Hello, thank you for having me. I am Dr. Dara. I am a adult psychiatrist. I practice in Philadelphia, the suburbs, as well as Center City, and my outpatient adult and adolescent practice primarily is a practice that focuses mostly with adult ADHD patients. And so ADHD, especially adult ADHD, does not exist in a vacuum. So most of my patients have at least one comorbidity, including anxiety disorders, mood disorders, substance use, eating disorders, and a bunch of other issues such as life transitions and, dealing with daily coping skills to manage those daily stressors.
All right, great. Well, we're definitely happy to have you.
Thank you for having me.
You're welcome. I mean, and so I think a lot of our listeners probably know a fair amount about ADHD, at least a lot of them I would assume. But, it's always good to, make sure for those that don't, that they have a realistic understanding of it. So would you be able to give like maybe a 20 or 30 second, really brief synopsis of what ADHD is and how you notice it specifically in adults?
Sure. So ADHD is really, it's not a disorder, a pathology such as anxiety or mood disorder, where everyone actually has some symptoms of ADHD since it's on a spectrum. And it's a neurodevelopmental disorder. So as people develop their neurology, their brain development, as it happens, what happens is there's some delays. And these delays are when they combine to affect the person's development and ability to focus and concentrate and regulate their emotions and their activity level, that's when we consider it a disorder. So for children, we see a lot of the core symptoms of ADHD, which is the issues with the focus and the attention, and those are the inattentive symptoms. And then we have the hyperactivity, the textbook type of little boy who's hyperactive, and then some of the impulsivity. But in adults, not only do we see those issues, but we also see what really is the executive dysfunctions. And so that's the issues that I had mentioned that have those delays. So basically issues with regulating one's emotions, regulating one's time, dysregulation of basically anything where there is some self-discipline. So the ability to really initiate tasks, complete tasks, all of that good stuff, prioritization, planning. And so for these folks, it really presents differently. And usually what happens is adults usually come into the office really complaining of, I'm just so anxious. I just feel so moody. I feel so down on myself. And so that's how you usually have to tease apart the mood disorder or the anxiety disorder, since underlying it all is really these neurodevelopmental issues that someone is born with, but may not affect their functioning until they, have some sort of life transition, such as the birth of a new baby or a divorce or something like that.
All right, great. Well, thank you so much for that great explanation. And I think an important point just to sort of reiterate to everyone is this idea that if someone has ADHD, even if they don't realize it till adulthood, the symptoms have always been there in some way, but that it might not have been as noticeable. So someone may have coped really well through childhood, and then maybe the demands of adulthood, whether it's with a job or a new child, something that really kind of throws someone off from what they're maybe more accustomed to, and that's where sometimes you can sort of see more of suddenly I can't do this anymore in the same way I could before. And that's where people start to recognize, oh, maybe I do have ADHD, or as you mentioned, sometimes people think it's anxiety or something else. So it's definitely important to kind of tease that apart with the professional to figure out what is actually going on, because it's hard to effectively treat something if you don't know what you're treating.
Of course. And I think the most interesting cases are the ones who come to me really having no idea that the issue is at all related to some form of executive dysfunction, where they really are just so surprised by the mention of that, especially the high functioning adults who really have done really well for themselves, whether it's interpersonally or professionally.
Yeah. And one of the questions I get asked a fair amount, or that comes up a fair amount in my practice, is this question of with medicine, what symptoms can realistically be sort of targeted and addressed versus what things do you really need stuff in addition to medicine in order to kind of fully treat with ADHD? I mean, would you tell sort of a client or a patient sort of if they ask you a question like that?
Yeah, that's a great question. And it definitely comes up in my practice a lot as well. And as the good old saying goes, pills don't build the skills. And I really think that the pills, meaning the medications, the first line treatment is stimulants. And so those medications for children, for adolescents, for adults really help with those core symptoms. And so those core symptoms, when we think of the inattentive symptoms, we think of focus, concentration, also motivation, forgetfulness. And then the hyperactive in an adult, we can notice some just more of that internal hyperactivity, so that restless brain. So usually the restless brain happens most when the brain, when you're not as distracted. So actually it's counterintuitive, but stimulants actually can help with sleep. So, 9 out of 10 folks actually, if they were to take the right dose of stimulant close to bedtime, it could actually help some of that insomnia. Many are afraid to do that, but that said, it also helps with some impulsivity. The symptoms that it doesn't help with as much are the ones that the adults usually really complain of the most, and that's really the executive dysfunction. So all the focus, all the motivation, all the, less impulsivity, it's still not going to allow me to make it so someone can really prioritize on that, that brief that one of my attorney patients has versus, going down a rabbit hole of social media, or to really help them, plan out some work project that they have and break down those tasks. That's where the skills are really important. And unfortunately, most of the real hard work comes in therapy.
Okay, great. Well, thanks for explaining that. I mean, I think this is definitely an important point. I think a lot of people don't realize is that, for most people, medicine is not sort of a magic, sort of fix for everything. That it certainly helps with a lot of the underlying symptoms, but the skills, it's not going to magically give you better executive function skills. It may help to implement strategies more easily, but you sort of have to sort of do the work in psychotherapy or coaching or something to be able to kind of get at, learning how to plan, organize your time, figure out different strategies and develop into routines. And for a lot of people with ADHD, that is one of the hardest things. Even if they kind of know what to do, they don't know where to start, or they have a hard time maintaining anything that they've tried. And I think there can oftentimes be, a feeling of disappointment, resentment that they just can't do it, feeling like they're always letting everyone down, lots of sort of negative feelings. And again, those are things that certainly are really helpful to work through in therapy, but also you need those skills of figuring out, how am I going to plan out tasks better? How am I going to stick to this system? And so that's where I think having a professional to help can be, it can be really vital, as well as also making sure that you're trying to pick systems that make sense. Because, for example, if it was as simple as picking an app to keep organized, I mean, there probably would not be as much of a need for mental health treatment for ADHD. The idea is that even if you have an app, first of all, you have to make sure it's a good fit for you, but it's often the implementation and the follow through that's the hardest part.
Yeah, no, that is so true. And I think that just touches on a lot of different aspects of why it is so hard. Number one, just that whole idea of, figuring out where someone is struggling. And most of the time, it's not that knowledge, as most ADHD folks have heard, it's really a disorder of performance. So, really, and I'm always trying to work through, even though usually I leave that up for you guys, the therapists, where the breakdown is, what area of that implementation of performance is there an issue. And I think that, finding a therapist who also does coaching and vice versa, sometimes the separation exists, but I think the skills are one thing, but really those, that touch on those emotions. And I think that, these adults who definitely receive late diagnoses, meaning, older than 20 years old, I would say 25 plus, really have so much emotional baggage. Not that we don't all have emotional baggage in our, after our 20s and been through heartache and loss. But I think with ADHD, you go so long not knowing why you can't do something, not knowing there's so much shame, and really shame, but guilt, shame, anxiety that surrounds the idea of Why can't I just pay my taxes on time? Why can't I just balance my checkbook? I know how to do it. Why can't I just do it? And so that's the whole issue, is really figuring out why these small mundane tasks are so hard for someone, and how you can come up not with structure, because structure, but real systems that work just for you, since one person's idea of a system may not be beneficial for a different individual.
Right, exactly. And I think a lot of people don't realize that sort of the emotional piece is extremely important. It's not just the skills. And they really have to address both. I think it's hard. I think there's some people that go to a therapist and end up focusing more on the emotional piece, but don't really get those practical skills. And that's where either going to a therapist that can do both, or
That's a
coach for that piece of it. I find for some people, because I do both sort of the therapy piece as well as coaching, a lot of times blending the two. But there are times where for some people that works really well. For others, based on a variety of factors, including the time and just different things, there can be benefits of sometimes having one person where you work on the direct skills with, another the more of the sort of the emotional piece. But I
Yeah.
think I think people don't always recognize that you sometimes have to, it's not one size fits all in terms of treatment.
No, and unfortunately, there's just not enough of, coaches, ADHD focused coaches and therapists. I mean, but yeah, it's such a necessary part of the treatment. My as helpful and effective as I call my meds, even though they're not mine, but what I do, yes, that's great. And actually, if you look at it it's probably one of the most effective medications we have. Well, I know for sure in all of psychiatry, but even in medicine, if you look at the studies, the effect size is pretty high. But even that being said, so much of it for an adult, more than even a child and adolescent, is based on those skills and those, kind of distress tolerance skills that you learn in therapy.
Right. And it's also not a quick fix. I think sometimes people sort of or a lot of us get very frustrated thinking, even if I'm meeting with someone, I just, I want a session or two and to be done. But it doesn't really work that way.
Yes, I think, because I mean, if we think about it, some of the main issues with an adult ADHD brain are really not being able to motivate unless there is some immediate gratification. And so the whole goal of bringing everything into the present, whether it's a, reward or whether it's a consequence. So, that reward of gaining that much out of therapy and not seeing the results quickly is very hard. And it's really hard for anyone to deal with, but let alone an adult ADHD brain. It's kind of, having to be consistent is also hard. And that, as I always say, the only thing consistent is going to be your level of inconsistency, right? And kind of blaming it on, if you get bored and all of a sudden you've decided to pick up skiing as that new hobby of yours to keep yourself motivated for exercise. And then, weeks go by, maybe you've done it a couple times and then you're bored by it, put it aside. Blame it on the skis, blame it on the mountain not being that great, but don't blame it on yourself. You may go back to that hobby, you may not. And the one thing's for sure is that adult ADHD is not a cheap disorder to have. It's definitely can get pricey in terms of needing to find something that really, engages your brain, engages yourself, and knowing that you can't be so hard on yourself since you need a little bit more stimuli than the next person.
Right. And obviously, in terms of the costs, sort of financial and otherwise, you have certainly if you have a hard time remembering to pay bills and things like that, or, work you're not doing as well as you might like, that may cost you promotions and other things. And so certainly on the one hand, there's the potential for lost money because of sort of having trouble keeping track of stuff. And, one thing that's sort of be helpful to think about, because sometimes people think about, even if they can afford it, the cost of treatment, then, it's so expensive. Why do I need this? But if you think about how much money are you losing by not treating it, that whatever, in a lot of cases, whatever you put into actually treating it, you're probably gonna get that money back in whatever sort of improvements you make to then be able to sort of function better.
That's so true.
But
That whole ADHD tax that comes with it. And I think, that's also just kind of, if someone can really start to understand that and really understand that in the long run, that can improve their ability to, keep their credit card balance down and not have unpaid bills and interest and all of that good stuff. It really will benefit them in the long run.
yeah, and along those lines too. I mean, there are lots of things that are really helpful for everyone. Things like basic self-care, getting enough sleep. Like I always think about sleep as an appointment you should attend consistently and on time every day. Not
Yes.
use whatever time you have left after you get everything done to sleep.
Yeah, I mean, I think for, these adults, there's so many reasons why there's sleep issues. Number one being most adults with ADHD have a sleep-wake circadian disruption, meaning the natural sleep chemical, the hormone melatonin, is not secreted at the right time. So that's number one. And then you have, most of my adults come in telling me, but finally, when my kids are asleep and my partner is asleep, I can finally have some peace. I can finally get some stuff done. And so those little lies that that we all tell ourselves, but with the adult ADHD, with the idea that you can be more productive at night, which is not always the case, but it feels that way because there's less distractions. And so one of the goals is really to allow yourself to figure out ways to have less distractions during the daytime hours so you can feel just as accomplished and just as productive during the day.
Right, exactly, because it's hard. I think, as you said, you identified probably a lot of very common reasons why people end up staying up later to do stuff. But also the idea, even if you feel like you're always getting stuff done all day and don't have downtime or time to sort of just to yourself, the problem is, that's not great for your body to always be in that kind of mode of go go go, and so
Yeah.
that can sort of then make you less productive the next day if you're so burned out.
Yeah.
And so it's
Yeah.
one of these things where, as I know, it's very hard to do, much far easier said than done, but to be able to slow down and say, even if I take 5 minutes to try to meditate or do something, a puzzle, something I want to be doing, or maybe a little more 5 minutes, but the idea of, even if I don't quite get everything done that I would like to get done, to take that time, because then you're going to feel better and be happier and function better the next day, and in turn then hopefully be more productive over time too.
Yeah, no, I think that whole slowing down is everything. It's key. And when I talk to folks that, whenever I say, the forgetfulness of leaving the room and putting down your keys, if I made you do slow down and really say out loud exactly where you put down your keys, most likely 10 minutes later, you would know where they are. And, most people respond, but that just sounds painful to have to say it out loud, to really be mindful in that moment. And I think that part of it is that that brain is just working so fast and gets so bored even by just taking the time to do those mundane, very repetitive tasks.
Right, exactly. And one of the things, treatment, especially with the increase in stuff online, is that for a lot of people, you can cut down travel time. If you forget and initially log on, probably the clinician can call you or remind you. So plus also being able to work in your own home rather than having to sort of go to an office. For if you're working on how to organize stuff, if you're doing an appointment from your own home, it's much easier to work. I find it much easier to work with people because then we can, set up the key, like I don't know, a drop or a, people call some people refer to it as like a drop table, where you basically put all the stuff when you first get home that you need to take with you all in one place, or whether it's organizing your desk area. And and obviously there's a lot that you can sort of set up even in an office to say, I'm going to go home and do this, by being able to set up in the moment and actually not have to follow through on doing it yourself at home. That can certainly help with the follow through, especially in the early stages of treatment.
Yeah, no, that's so key. And I think just the whole idea of switching to a lot of virtual treatment has been really helpful in that way, to really see them see clients, where they are really struggling the most. And usually it's in their work environment, which a lot of them are working from home, or at home in general. And just, I think there's a lot of shame surrounding that. I have these high executives who really just cannot get their desk organized. And, that is very common. I think just accepting the fact that that is common, 9 out of 10 adults with ADHD have some form of disorganization, whether it's, their space or their thoughts or what their emotions. There is some level of disorganization. And, once you accept that, I think it's easier to work through it with a professional like a coach, therapist.
Yeah, no, exactly. Because if you have this sort of physical clutter, it's harder to be focused because there's this constant distraction of all the clutter around you. So sometimes, the organizing yourself physically can sometimes be a good first step towards organizing sort of yourself mentally.
Yes, definitely. And I always am saying there's so many things, there's so many ways an adult ADHD brain can be distracted, right? I think just the visual clutter, auditory, like sounds, kids screaming when you're working from home, but also emotions. And I think that's something that most folks really don't pay as much attention to, but all those emotions, the the fear, the anxiety, the shame, all of that is distracting too. And another reason why therapy is so important, right? The reason, you can't motivate to do that, that project may not just be because you need quiet, but you need also quiet and some understanding of why you keep, harping on how bad you feel about not starting the project and
Right. And I think that,
processing.
yeah, and I think that's also the idea of your mindset. If you have a negative mindset, I can't do this, you're probably not going to be able to do it, and you're going to continue to be hard on yourself. If you can sort of create, I know this is, again, easier said than done, but work to be able to have a positive mindset that, I'm trying something different. I'm trying to make this work. Even if I don't get it done perfectly, at least I'm doing something different to try to make it better. And I
Yeah,
think sort of that over time can help towards, actually seeing the results you want.
no, definitely. I think, yeah, just kind of doing, right? Doing and then feeling, and that, kind of not waiting for that perfect moment when you feel in the mood, right? Because that may never come, but knowing that if the more you just start, the better you're most likely going to feel. And that's all part of those different techniques of like the Pomodoro method and other, different ways to kind of trick your brain into doing.
Right, exactly. There's a lot of strategies out there, things you can do, and it's also a matter of creating some sort of organization to the strategy you could use. Because if you're constantly jumping from one thing to another, and it doesn't actually, there's no consistency in how you're doing it. If there's some structure to it, sometimes that could sort of work depending on what you're doing. But in a lot of cases, you're just going to get yourself distracted and not actually follow through on stuff. If you're constantly, like, for example, if you keep switching between tons of different apps or keeping track of your tasks, if you have all of your tasks in, 8 different apps, that's going to be very confusing and probably hard to use to follow through on, unless you have a set system of what kinds of tasks are in each one. But even that probably is a lot of
Yeah.
task lists.
Of course, I do have a lot of patients that come in really overwhelmed by what app to use, where to start, which one's the best, which one should I use for organization or prioritization or to do? How do I almost, sometimes I'm at a loss what to say, what to do. Any suggestions in terms of, what to tell these folks of any good, I don't want to give suggestions of specific apps, but at the same time, I don't want them to feel overwhelmed by going through them all on their own.
Right. I mean, what I often do, I think I read an article a while ago about this because this had come up in, I think, a professional organization I was in terms of looking at kind of organizing tasks. And so, like, what I often tell people is let's first go step by step and think about what do you want to keep track of in this program. So determining, do you just want to keep track of civic tasks? Are they just for home, for work, for both? Do you need to keep track of calendar events in the same place, or do you want to keep that separate in a calendar? Because some of the programs will connect with a calendar also. So just understanding, basically the idea is you first want to understand what information do you want to keep track of? Do you have certain preferences? Like, are you someone that really relies a lot on color coding? Are you someone that really wants to see stuff visually on a calendar, even if it's a task? Or do you prefer a list? Because if you can understand the basics of what someone might want and what their goals are with it, then basically you can look at different programs to try to match that to their needs rather than picking a program and trying to fit their stuff into it.
Yeah,
So I would use that as
really great point.
So I would use that as a starting point. And then from there, I mean, what I often do is I show clients a couple of different programs that I think would make sense and give them an opportunity to sort of either say, this is what I want to use, or like this feature on this one, but I'm not really sold on this. But, I mean, a couple I can think of just, are definitely worth sort of checking out depending on your direct needs. If you want more of like a structured program, something like Todoist or TickTick are good because, they integrate with a fair amount. They're a task list, but they both connect to a calendar also. And they're helpful not just for knowing what you have to do, but you can also plan quite a bit because you can break down tasks into subtasks and schedule times for each one, in the program. So those are two, for example, that are helpful. If you're thinking about like very basic stuff, you don't need a whole lot of planning. Probably using whatever's built into devices you already use might be helpful. Like, so, for example, the Reminders app on Apple devices or Google Tasks if you have an Android device. I mean, technically, you can use Google Tasks on Apple devices as well. But those ones, give you the basics in terms of keeping track of tasks, and you can do subtasks. But they don't offer as many different planning options as some of the other programs do.
Got it. Yeah, no, that's great advice. I think that, definitely, there's definitely a struggle of just, knowing where to start, right? Even when they want to start.
Right. And sometimes the idea is because what I'll do a lot in appointments is we'll basically, figure out what someone wants and then actually, create an account and set up a task list, during the session where we then start putting stuff in. Because sometimes with the task list, it's not just about keeping stuff in there to know what you have to do, but it's also about getting the habit of using it. And so one of the things that can be helpful at the beginning is to sometimes put a few things in there that you actually remember to do normally. Like let's say eat dinner or brush your teeth. I mean, some people do need help remembering to brush their teeth, but for someone that's just something they do normally without having to look at a list, the idea then becomes they see it pop up and they get in the habit of marking it off. So instead of having to remember to do the task from the list and mark it off, they just use those tasks to help reinforce the idea of I see this pop up. Once it's done, I mark it off.
Yeah. And I think that really can help with some of that, taming that shame that goes along with choosing tasks that they don't always get done, right? They know usually they're going to eat dinner. And so they're going to feel maybe not accomplished, but feel some sense of, I guess, accomplishment just by checking it off. And also, is there anything that with the idea of not maybe having the task list, whatever app you choose, and then maybe not following through, kind of allowing yourself to be okay with not being as productive or moving the task to the next day? Anything particular
Yeah.
to let
So,
them know?
I mean, yeah. So I would say no matter how good you are at planning, things come up. It's almost impossible for anyone, no matter how good you are at planning, to set up something and have it work perfectly. So you have to have some flexibility built into it. So if something comes up and you can't get done what you want or what you plan to, not just saying, "Oh, I'll do it tomorrow," but actually looking at your schedule and thinking about when is a good time when I'm available to do it. So being intentional in how you move stuff off of a task list for one day and schedule on another day at a certain time when you're likely to be free. The other piece of that is if you're using a task list, you also have to look up when you're free to do these things. So that's where also looking at a calendar to see, what are your events? When do you have blocks of time that are free? And in some cases, maybe creating certain categories of time. So for example, I'm going to say this is a time, this is a 1 hour block where I'm going to devote just to paying bills. Or this is a 2 hour block, I'm going to do all household chores. Because then sometimes by grouping things together, and then this way you have a time blocked out in the calendar for this is, let's say, household tasks. And then you have the specific household tasks in a task list can be a great way towards increasing the follow through and getting stuff done.
Yeah, that makes so much sense. And then do you usually have clients add those enjoyable self-care, time with friends, family members onto their lists and
Yeah.
calendars?
So in a lot of cases, I'll have people do that because I think it's important that you make that time. And so the idea is if you pick and choose these kinds of events, I'm going to put in the calendar, these kind of not, it's going to be harder to sort of use stuff regularly. So that's where, sort of blocking out that time to sort of, make plans or, when you have to make plans, put them on a calendar can be really helpful. And I mean, even like, so for example, the Tick app I'd mentioned earlier, there's actually a habit tracker. So you can actually set it up for certain things that you want to do. You mark it off and then it tells you, how many days in the past week have you done X, Y, or Z, whether it's working out, meditating, whatever it is. Then that can also help be a motivator to see these are all the times I have followed through on this thing that I want to do for myself.
That's interesting. Yeah.
And for a lot of these programs, you can also put events as reoccurring. So for the stuff that keeps popping up, by setting it once, then you don't have to constantly remember to keep adding everything in. The key though is to maybe have a set planning period. So when you have the time to really sit and just not feel rushed, to actually look at what you have to do, what's overdue, what do you need to reschedule? Because once you get in the habit of ignoring lots of notifications, the program's not going to be that helpful if you're used to ignoring notifications. But if you can get in the habit of not ignoring them, and like for example, in the reminders app, as long as you have the settings the right way, the alerts stay on your home screen until you close out, until you delete or mark off the task. So anytime you open or close your phone, the alert should be right there, which means that it really gets your attention of, oh, I still have to do this.
Yeah. And that reminds me of just the whole idea of not everyone does well with the electronic apps, or, they need more of that visual hands-on reminder, whether it's a calendar, a daily to-do list, or just, whatever. I almost have them laminate, some sayings that will be helpful and motivating right in their work area. So, externalizing that idea of time or, productivity or whatever they want to, what their intention is of the day.
Right, exactly. And that's a really good point that not everyone does well with technology, or it may be certain things you use technology for, certain things you don't. that for some people, maybe it's great to have sort of the master list of everything electronic because it's easier to kind of readjust stuff. But that maybe for the daily plan, you write on a whiteboard each day or a piece of paper in front of you. So this way you don't have to rely on an electronic device to access your task list or what you need to do.
Yeah. And then also, I think that a lot of them kind of look at that large list of tasks and feel overwhelmed. And so if you have just a daily to-do list that's, I don't know what you would suggest, no more than 3 to 5 things, I think it can really limit that distraction of being overwhelmed by your overall task list, which,
Right, exactly. And that's where also when you're planning, that's why a lot of the programs will let you keep separate lists for the different categories of things. So instead of having 50 or more things in there total, maybe you have 5 to 10, even if you're not going to do them all in that day. But like, let's say for household tasks, you have maybe, I don't know, 15 things on a list, but the idea, or 10 maybe for a certain category, but the idea then is they're not all scheduled for the same day. So when you look at what do you have to do today, a lot of them will self-generate a daily to-do list for you, but it's far fewer things and it pulls from all categories. So this way you don't have to keep looking at every single thing you have to do and then decide. You basically, as long as it's planned out, you just look at, what's scheduled for today. And then it basically gives you an itemized list of what to do. Or you can obviously write that out on a piece of paper or a whiteboard also. But this way it makes it less stressful because you don't have to keep looking at everything you could be doing. Just you look at the things that you decide you're going to do for today. And then if you get them done, have extra time, then you could look at the other things.
How much time should one really consider in planning out? How long each week is it that they will set aside time to plan out their, whatever it is that they're using for the week, their calendar time blocking?
Yeah, it's a good question because certainly I see in some cases people with ADHD, and even those that don't, sometimes end up get so distracted by the planning because they feel like they're being productive, which is largely true. But sometimes the planning takes so much time that then becomes a distraction from actually getting started on the task. So it's a fine balance. Like I would say in general, you want to figure out what's the least amount of time you could devote to planning to be as efficient as you need to be. So any system you're using should not take ridiculous amount of time. Like I would say on average, really. Maybe it's helpful if you really need a lot of time to plan to pick one time a week, or maybe you spend a half hour, an hour if you really need that much time to do the in-depth planning for the week, with the idea that maybe on a daily basis you spend maybe, I don't know, 5 to 10 minutes in the morning if needed, just double checking your list and making a plan. And then at the end of the workday, maybe 5 or 10 minutes just figuring out what did you not get done that you need to, and then adjusting stuff. But this way, during the bulk amount of time you have to get stuff done, you're actually getting stuff done and not just planning, but having enough time that you can sort of plan throughout the week without it taking up too much time. Because really the idea would be that whatever time you spend planning, that you could ultimately make that up in your efficiency.
Okay.
Because of the plan.
So a little bit in the beginning, maybe the longest period in the beginning of the week, and then throughout the week, it sounds like if you do a little bit, a couple minutes in the morning and after your work day or your day, that it really will help make it a little bit more a habit and automatic.
Right, exactly.
Just dreading it. Makes sense. Yeah. These are great tips.
Thanks. Yeah, well, this was great. I think it was definitely a really good conversation. I hope to our listeners it was really helpful in understanding more about what adult ADHD is, and also a lot of different treatment options and things to consider. I guess before we go, I'm wondering if you have any final thoughts or anything you'd like to share with our listeners.
I think that everyone really should know that it's never too late to obtain a diagnosis of adult ADHD. I don't care if you're in your 20s, 30s, 40s, 50s, 70s. I have a patient who's even approaching 80. But I think that knowing that, these issues don't get better with time, if anything, they can get worse and they can cause issues with memory or some, impairment, in terms of emotions. So I think just really, not feeling, shame or as much, or trying to let go of the idea of shame and anxiety, and really reaching out for help if you feel like these issues are affecting you, at least at work or at home, or just overall with your self-esteem.
That's definitely good advice. And if people want to reach out, where can they find you?
They can find me. So it is Dr. Dara, psychiatry.com. And then my email is drdara@drdarapsychiatry.com. And that is if they are in Pennsylvania or New Jersey. They can also, there is a little bit of a Wix app that they can connect to from my website as well, which has some lovely resources.
Oh, well, that's great. Well, thanks again for joining us today. This is definitely a great conversation.
Yes, thank you for having me.
You're welcome.